Lincoln Community Hospital is a critical access hospital on the plains of eastern Colorado. Located approximately 110 miles east of Denver and 90 miles east of Colorado Springs in Hugo, Colorado. We currently provide services to portions of 5 counties with a service area population of over 11,000 people, spanning over 5,000 miles. Established in 1959, the hospital was initiated by area war veterans who identified the need for health care in our rural area. They worked together, donated materials, labor, and land to accomplish this goal. That is the very embodiment of our motto, neighbors caring for neighbors. LCH is so much more than just a hospital.
Imagine serving an area the size of the state of Connecticut, approximately 10,000 square miles. Now imagine a population density of about 1 person per square mile. If you can consider that, that's what Lincoln Community Hospital does every day. Not only do we provide inpatient services, but we provide a full range of outpatient services, home health care, hospice, long-term care, assisted living, and primary care clinics, along with a wide range of specialty clinics. It's tough business. You can't be a wimp and be in rural health care. You got to be strong and courageous. The videos you're about to see are experiences that our patients, family members, experience with us when they come to us for help.
We have a vast area that we cover, the county and from Denver to Kansas and everything in between. And it's kind of a pain for somebody to go in to Denver or to the Springs to go get their toe checked or to get anything done. They can come, we can manage everything for them, and it's in their backyard and it's in their community. We know them. So I think we're a big staple of the community. So it's not just we provide patient care, it's we care for the family, and we see them out at the grocery store, we see them at the restaurants. So it's more of a community pillar, centerpiece holder for all the families and everybody that lives in Lincoln County.
I'm the Director of Nursing for Lincoln Community Hospital. I started here as a new grad RN in 2012 and progressed to the ADN and the DON position within the last few years. This is the community that I grew up in, and it's very special to me, which is why I came back and chose to serve here as a rural nurse. I think rural nursing has many advantages, and I think we're held to a higher standard because the people that we take care of are ones that we see every day and know on a more personal basis. This hospital has impacted my life, and I know throughout my community, just because of the opportunity that it provides for people who are career nurses to live in a rural area and practice their trade. And it also helped save my dad almost 10 years ago when he had a significant fall and had to be airlifted to a higher level of care. I was also born here as well as my sister, so that impact is also one that will ever be treasured. The joke is that my office is the old nursery, so I just ended up where I got to be started. So,
That's good.
I feel like the hospital here is, I don't even think you can put into words what kind of asset this place is to this community. We are such a small community and very remote. It takes quite a bit of time and money to get into the city to get health care, and this place offers a huge variety of services that people would be without otherwise. That not only do we offer patients health care, but we offer citizens employment. This is a very large employer of the county, and a very, very valuable resource that we have here, I feel.
Lincoln Health is really what I would consider one of the bright spots of Lincoln County's economy. When we talk about rural Colorado, you really do a lot of comparing and contrasting how our urban neighbors along the Front Range have many amenities, especially when it's culture and shopping and all of the different things that are great lifestyle pieces that attract people to live there and go there. And then when we talk about healthcare, Lincoln Health happens to bring to the table a set of healthcare services that are not secondary to our urban neighbors, and in fact are as good as or better in some parts than we see along the urban corridors. And because of that, Lincoln Health brings a vitality to Lincoln County's economy and the surrounding area that we don't typically see. I think that we're very lucky and we're very blessed to have Lincoln Health. I believe that this healthcare organization represents a leading role in providing those health services for the area. How does it? The other element are all the number of jobs that Lincoln Health provides. It provides, I know, more than 150, I believe, different jobs to working professionals, and that is a huge part of what our local employment base enjoys. And these are good paying jobs.
So our facility is the only hospital within about a 70-mile radius. We are a level 4 trauma center designated with the state. We see about 8 ER patients a day with acuities from colds and coughs all the way to true MIs and car wrecks. Without this facility, there's a lot of people who would not receive the care that they need to make it to definitive treatment. I think that's one of the big pearls of rural facilities in general, is just doing a good job at what they do so that patients can receive the highest level of care that they can. And without rural facilities, they're not able to get to that point.
Okay. Well, I was excited when you called me, Erica, to talk about the hospital and the clinic. It's been really an instrumental thing in our family and our extended family. From my parents and my wife's parents to our children to our grandchildren, they've all been involved in this. So it's been key for us, because without it, we would have had to been traveling to Colorado Springs or Denver, and it's just been a real blessing. So yeah, that's why I'm excited about talking about it. I personally have had some pretty severe situations. I had a pickup truck fall on me and crushed my sciatic nerve and busted my pelvis, and after 4 operations and a couple 3 years, well, I healed up, but boy, at the time they were critical. They took care of me and then got me sent on to Colorado Springs through the helicopter, and it was just a life-saving thing for me.
This is
Hi.
lighting.
I'm Gail Huff, and I'm an employee with Lincoln Community Hospital, the Behavioral Health Department. 3 years ago, last April, I died. Obviously, it had no impact on me. Fortunately, I was in the right place at the right time, surrounded by wonderful people who knew exactly what to do and how to do it. The survival rate for a cardiac arrest is about 1 in 4,000. I beat the odds all over the place. And every day I see these people I work with and are friends with, and I'm just blessed. I love them all. And they love me. And I'm in the best place in the world to do my job and to work with this group.
On May 1st, 2014, I had a heart attack, and like they always have, they took me in quickly. Glenda and Lisa were even nice enough to drive in the ambulance when they took me to the hospital in Hugo. And Glenda had already called the helicopter knowing the severity of the situation, so the helicopter was already in Hugo just about the time I got there. I'd like to take this opportunity for them basically saving my life.
And the success has really been with being located out here further from town. Gives us a lot more opportunity for faster response times to getting to patients and getting them back there to your bigger facilities with the specialty services that patients often can need that isn't out here in these locations. And it also working with the hospital staff, a lot of the patients that get brought here to this facility then we have a working relationship with the staff to come over from our location, talk to them, find out what's going on with this patient, anticipate this patient may be leaving this facility to get definitive care at a larger facility, and we can just be involved in the care at an earlier stage than flying out from town and kind of starting from scratch, trying to get in and out of the hospital as quickly as possible. We can come over from our quarters, help out for an hour or more before the decision is made to move them to town.
My name is Troy Monroe. I come from the city. I've had a lot of experiences in big hospitals, and I've had very little experience in little hospitals. But the experience I've had has been wonderful. The people are amazing. My wife Lucy came in initially with a fever, and it ultimately got diagnosed as leukemia. In Denver the last time, they told us we were, there was nothing that could be done for Lucy. We had exhausted all the treatment options, and they told us the best option was to go home for hospice. The quality of service that we got from the entire staff was amazing. Lucy passed away on August 30th at 2 o'clock in the morning, and I made a call to hospice, and Jenny was there within 5 minutes. I was truly amazed. And they helped me get through the process of her passing. I've never had to deal with anything like this before, and they made the whole process bearable under the circumstances. I'm very thankful for all the help that they gave me, for everything that they did to make this process as easy as possible.
I have nothing but praise for the Lincoln Community Hospice Program. Our mother was 97 years old, and she had a chronic lung condition that was continually getting worse. And she was getting tired and weary, and she was wanting to refuse treatment. Upon consultation with Dr. Fox, she made the decision that she was going to refuse her treatment, and she did so with peace in her heart, and she started making plans. And at this time, the hospice stepped in, and they so graciously helped our family to accept unselfishly and embrace the decision that she had made. Her end-of-life care was very compassionate and professional, and she passed with great strength and dignity. And I truly do believe that this was because of the wonderful care and support that she received from hospice.